Okay, well, good afternoon and welcome to the Supporting Client Health and Wellness class presented by the Far Northern Regional Center's clinical team. My name is Jen Badger and I'm an RN and I work for Far Northern in the Reading office. And it's my pleasure to introduce Nellie Camarena, our nurse in the Chico office.
Hi, welcome everyone.
So it's really nice to have all of you here today, and hopefully you're going to find this information really useful in the day-to-day care of regional center clients. Our classes cover a variety of health topics and common health problems faced by individuals with developmental and intellectual disabilities. The first 4 classes have primarily focused on mental health, and we're in the 3rd class in that segment. So I'm going to go ahead and get started with Psychiatric and Behavior Management Medications, Part 2. Okay, so psychiatric medications are prescribed primarily for controlling challenging behaviors such as self-injury, aggression, agitation, or psychiatric symptoms like disorganized thinking or hallucinations, depression, anxiety. I think I had this slide on last time too, but just a recap that's generally the 2 areas that are being addressed when somebody is taking a psychotropic medication. So the medications are called psychotropic, meaning that they affect how the brain works. Primarily, the way these medications affect brain function is by changing the way that neurotransmitters, or the chemical messengers in the brain, are sent and received between the brain cells or neurons. And you might recall last time I had some slides with pictures of a neuron and the anatomy of a neuron and neurotransmitters and receptor sites and such. So if you need a refresher on the biology piece, I would suggest going back and watching the class that was done in August. So psychotropic medication classes fall into 6 main categories: antipsychotics, antidepressants, and mood stabilizers, which we talked about in the previous class. And today we're going to talk about anti-anxiety medications, sedatives or hypnotics, and stimulants. So anxiety is a normal human emotion that everyone experiences at times. Many people feel anxious or nervous when faced with a problem at work or before taking a test or making an important decision. Anxiety disorders, however, are different. They can cause such distress that it interferes with the person's ability to lead a normal life. Anxiety disorders include panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, social anxiety disorder, specific phobias, and also generalized anxiety disorder. For people with anxiety disorders, worry and fear can be constant and overwhelming and even crippling. So here are the different types of medications that are used to treat anxiety. Benzodiazepines, or benzos, as a layman's term, beta blockers, which are actually usually prescribed for people with high blood pressure, antihistamines, which also work for control of allergy symptoms, and antidepressants, which are typically prescribed for depression. But all of these can also be used for anxiety. So benzodiazepines are the most common class of anti-anxiety medication. They relieve anxiety by calming the central nervous system. Because they are relaxing, they're sometimes prescribed as sleeping pills and muscle relaxants. They include Xanax, Valium, Ativan, Klonopin, as well as some others. Benzodiazepines are fast-acting, typically bringing relief within 30 minutes to an hour. Because they work quickly, benzodiazepines are very effective when taken during a panic attack or another overwhelming anxiety episode. It's important to be aware of the risks of anxiety medication, specifically benzos. Anti-anxiety drugs like benzodiazepines work by reducing brain activity. And while this temporarily relieves anxiety, it can cause a wide range of unpleasant and sometimes dangerous side effects. Many medications for anxiety are also habit-forming and physically addictive, making it difficult to stop taking them once you've started. People who take benzodiazepines also tend to develop tolerance to the medication, meaning that it takes more and more of the medication to get the same effect. For these reasons, most providers try not to prescribe benzos for routine management of anxiety unless other medication classes have failed to control symptoms, and generally won't prescribe them to people who have a history of addiction or drug-seeking behavior. On this slide, you can see some of the common side effects of benzodiazepines: drowsiness, slurred speech, slow reflexes, dizziness, blurred vision, and even depression. These side effects can cause problems with work, school, or everyday activities such as driving. Some people will feel a medication hangover the next day. The higher the dose, the more pronounced these side effects typically become. Some more serious side effects are oversedation. Because benzodiazepines are metabolized very slowly, the medication can build up in the body over time when used for a long period. The result is oversedation, and people who are oversedated may look like they're drunk. As with all nervous system depressants, there's a risk of overdose and death if too much is taken. Long-term benzodiazepine use and higher doses are believed to increase the risk of both depressive symptoms and suicidal thoughts. Benzodiazepines can cause emotional blunting or numbness, and they can also block feelings of pleasure and pain. Some people have paradoxical reactions to benzodiazepines. These effects include anxiety, agitation, irritability, and hostile or aggressive behavior. Hence the term paradoxical, because these are the same symptoms that the medication is meant to relieve, but it actually makes them worse. Elderly people are more susceptible to paradoxical side effects, but that doesn't mean that anyone can't have that. Typically, if somebody has paradoxical effects from benzodiazepines, it's important to make sure their doctor knows that so that they don't prescribe that medication for them. Antihistamines are also used for anxiety, and the two most common are hydroxyzine, which is also known as Vistaril or Atarax, and diphenhydramine, which is just Benadryl. The reason why antihistamines are relaxing and sedating is because they can cross the blood-brain barrier and block H1 histamine receptors, causing a numbing of the nervous system. I think a lot of people can say that if they take Benadryl, they get really sleepy, right? And that's the antihistamine working on blocking those receptors. Granted, though, it's important if you're taking an antihistamine that you're very careful, because antihistamines can also have significant side effects. They can impair cognitive and motor function, they can cause drowsiness, but they can also have severe side effects like poor sleep quality, which is really important to know if you have a client who is taking diphenhydramine, usually not hydroxyzine, but diphenhydramine I see often ordered for insomnia. But interestingly enough, the sleep quality is not always the best with antihistamine. Even though they're sleeping, it alters the state that they go to when they're asleep. It causes really bad dry mouth, dizziness, and low blood pressure, which increases the risk for falls. And it, in high quantities, can damage the liver. Antidepressants can also be used for the management of anxiety, and they're often preferred over traditional anti-anxiety drugs because they're not as dangerous as benzodiazepines or antihistamines. They have less risk for dependency and abuse. However, antidepressants can take 4 to 6 weeks to begin relieving anxiety symptoms, so they can't be taken as needed. For example, antidepressants wouldn't help at all if you waited until you were having a panic attack to take them. They have to be taken every day, routinely, and then the effect builds up over time. And then after several weeks, they start working. Some antidepressants prescribed for anxiety are Prozac, Zoloft, Paxil, Lexapro, Celexa. Those are all SSRIs, which you may remember us talking about in the last class. The other one on here is doxepin, and doxepin is a tricyclic antidepressant. But the reason why it can help with anxiety is also because it's 5 times stronger than Benadryl as an antihistamine. So it's very sedating. And that's why sometimes it is used for anxiety disorders. And there's others that doctors may choose to use as well, just depending on the patient. So let's move on to beta blockers for anxiety. The 3 that are usually prescribed are propranolol or Inderal, atenolol or tenormin, and metoprolol, which is also known as Toprol or Lopressor. Beta blockers are a type of medication used to treat high blood pressure and heart problems. However, they're sometimes prescribed for anxiety. Beta blockers work by blocking the effects of norepinephrine, a stress hormone involved in fight or flight. This helps control the physical symptoms of anxiety, such as rapid heart rate, a trembling voice, sweating, dizziness, and shaky hands. Because beta blockers don't affect the emotional symptoms of anxiety, such as worry, they are most helpful for phobias, particularly social phobia, and performance anxiety. Beta blockers include these 3, but there are other beta blockers out there that may be used, obviously depending on the individual. Common side effects of beta blockers can be nausea, lightheadedness, sleepiness, but of real importance is the unusually slow pulse or heart rate and low blood pressure, right? Because these are used for controlling high blood pressure. So it's kind of understood that if you take a beta blocker, it's going to lower the person's blood pressure. And for somebody whose blood pressure already runs a little low, this could be a bad thing, right? What happens more often than not with low blood pressure is the risk of falls due to dizziness or lightheadedness when changing positions. Unusually slow pulse is another side effect of a beta blocker. Beta blockers control heart rate. So they're meant to keep the heart rate fairly low. But some people, when they take beta blockers, especially on a regular basis, their heart rate can actually go too low, and that's not good. So it's important when those individuals go to the doctor that they're having their heart rate checked and their blood pressure checked to monitor for those things. You definitely want to let the doctor know if a client you care for who's on a beta blocker has a very low heart rate of less than 50, or if they get dizzy or have fainted. So I know this class is on medications, but I do want to talk about non-drug treatments for anxiety. Medications can provide temporary relief of anxiety, but it doesn't treat the underlying cause of anxiety disorder. Anxiety disorders really require non-drug treatments to produce lasting relief. And these can include psychotherapy, counseling, lifestyle changes, exercise, and relaxation techniques, such as deep breathing, guided imagery, and meditation. And hopefully these are all things that you work with your clients on to try and help them manage their anxiety, is learning those relaxation techniques and getting connected with counseling or therapy if they would benefit from it. Okay, so we're going to switch gears to sedatives and hypnotics. Sedatives and hypnotics are taken to treat insomnia, panic disorder, ADHD, and intermittent explosive disorder, to name a few. I'm sure there's other things that people take sedatives or hypnotics for, sedatives primarily, right? But for this category of medications, I really want to focus primarily on insomnia. Behavior and sleep environment changes are generally the best treatment for persistent insomnia. However, there are times when prescription sleeping pills may be helpful. Although sleeping pills don't treat the underlying cause of a sleeping problem, they may help people get some much needed rest. And today's prescription sleeping pills don't carry the same level of risks of dependence and overdose as sleeping pills of the past. But there are risks, especially for people who have certain medical conditions, including liver and kidney disease. So here you can see the lists of some medications used for insomnia on the left-hand side. These are prescription insomnia drugs, and I'm going to talk about a few of those. But also in the middle is the over-the-counter sleep aids, which primarily include diphenhydramine or doxylamine. Sometimes antidepressants, sometimes benzodiazepines, although these are not the same as the benzodiazepines we talked about for anxiety. These are specific for helping people sleep. And also there's the antihypertensive medication clonidine, which is used as a sedative. And antipsychotics, I listed Seroquel because Seroquel is often at a low dose prescribed for insomnia, but we'll talk more about each of these separately. And I apologize, I didn't make a separate slide, so I'm just going to go over the prescription insomnia drugs first. So the original version of Ambien works really well at helping people get to sleep, but some people tended to wake up in the middle of the night. So Ambien CR, which is an extended release version, helps people not only go to sleep within 15 to 30 minutes, but it also helps them stay asleep. And it's really important not to take Ambien or Ambien CR unless you have at least 7 to 8 hours to sleep. Then there's Lunesta. Lunesta also helps people fall asleep quickly, and studies show that people sleep an average of 7 to 8 hours. But you wouldn't want to take Lunesta again unless you're able to get a full night's sleep, because it can cause grogginess. Rozarem is a newer sleep medication that works differently than the others. It works by targeting the sleep-wake cycle, not by causing central nervous system depression. It's prescribed typically for people who have difficulty falling asleep. It also can be prescribed safely for long-term use, and the medication has shown no evidence of abuse and dependence. So that's nice. Although I'll say I rarely see Rozarem actually prescribed, but it is available. Of all the modern sleeping pills, Sonata stays active in the body for the shortest amount of time. And that means you can try to fall asleep on your own. Then if you're still staring at the clock at 2 a.m., you can take it without feeling drowsy in the morning. However, if the issue is waking up during the night, this might not be the best choice. Then regarding benzodiazepines, these are older sleeping pills, Halcyon, Restorol, and Valium. They're useful if you want an insomnia medication that stays in your system longer. For instance, they've been effectively used to treat sleep problems such as sleepwalking and night terrors. However, these drugs cause you to feel sleepy during the day and can also cause dependence, like we talked about with benzodiazepines, meaning that you may always need the drug to go to sleep. And then I'll talk real quick about antidepressants. Insomnia is a common symptom of depression, and therefore some antidepressant drugs, such as trazodone, are particularly effective in treating sleeplessness and anxiety that's caused by depression. Some antidepressant or anti-anxiety medications are supposed to be taken at bedtime because they're known to induce sleep. And again, there's doxepin, which is the tricyclic antidepressant. And that one is really approved for people who have trouble staying asleep. It can help with sleep maintenance by blocking the histamine receptors, but you don't want to take doxepin unless you're able to get a full 7 to 8 hours of sleep. And the dosage is based on your medical condition, age, and response to therapy. Then we have over-the-counter sleep aids. Most of these sleeping pills are antihistamines. They generally work well, but can cause some drowsiness the next day. They're safe enough to be sold without a prescription. However, if you're taking other drugs that also contain antihistamines, like cold or allergy medicines, you could inadvertently take too much. And then regarding antipsychotics, many antipsychotic medications are ordered to be taken at bedtime because most of them do have sedating side effects. However, if it's determined that daytime sedation is needed, then they're ordered to be taken in the morning or during the day. The one drug commonly given at a low dose, just as a sleep aid, is Seroquel. It's important to know, though, that even at really low doses, Seroquel can cause daytime drowsiness. And then there's clonidine. Clonidine is an antihypertensive medication that controls high blood pressure. It's also classified as a sedative and is often used by people who struggle with ADHD, PTSD, and anxiety disorders. For individuals with ADHD, clonidine's inhibition of norepinephrine in the brain improves focus and corrects deficits in attention. It also is effective for stimulant-induced insomnia in those with ADHD and ADD who are on stimulants. Clonidine is used off-label to control behavioral dysregulation in individuals with autism. Studies have shown clonidine can reduce self-injurious behaviors, aggression, hyperactivity, rigidity, reactivity, insomnia, and social behaviors. Because clonidine lowers blood pressure, it's important to watch for side effects such as dizziness, especially when changing position from laying to sitting or sitting to standing, otherwise known as orthostatic hypotension, meaning when your body changes position, your blood pressure drops and gives you dizziness. It can cause you to faint. I'm sure we've all probably had those times where we got up too fast and got lightheaded, and that's orthostatic hypotension. But when you're on a medication like clonidine, it can be a chronic issue where every time you get up, you have dizziness. And of course, that increases the risk of falls. So sedatives and hypnotics have side effects, right? As we talked about, increased risk of falls, low blood pressure, complex sleep-related behaviors. I'm sure you've probably heard stories about people who took Ambien and then got up and cooked a meal or drove their car and didn't remember it. So those are definitely things to keep an eye on if somebody's taking a hypnotic medication. And then daytime drowsiness. A lot of sleep medications do make people feel tired the next day. All right, so the last group of medications that we're going to talk about today is stimulants. Stimulants are used for the treatment of ADHD or attention deficit hyperactivity disorder, ADD, just attention deficit disorder, but they're also taken for narcolepsy, somnolence, which is where you're just sleepy and tired and not able to wake up and get excited about life. And obstructive sleep apnea, because people with obstructive sleep apnea, especially if they're not using a CPAP or BiPAP at night, tend to have very disturbed sleep. And so they're just tired the whole next day. And for some folks, stimulants are prescribed to help them with that. Ooh. Okay, so methylphenidate and amphetamine type stimulants are the most common type of medicine used to treat ADHD. They work well for 70 to 80% of people who take them. Stimulants work by increasing the availability of the neurotransmitters dopamine and norepinephrine in the brain, which makes the pathways in the brain work more effectively. Messages in the brain are better transmitted and received in the neural network. There are a lot of different stimulant medications, as you can see on this slide, And some people respond better to one than another, depending on how they affect these neurotransmitters. Methylphenidate type stimulants block the reuptake of dopamine and norepinephrine in the brain. And so if you recall the picture that we shared last month, they're blocking excess dopamine and norepinephrine from being absorbed back into the messenger neuron and making it more available to the neurons that are receiving those messages. They also promote the release of dopamine, so there's even more dopamine available for use. Amphetamine-type stimulants mostly increase the release of dopamine and norepinephrine and have less effect on blocking reuptake. Other types of stimulants, such as Provigil, Nuvigil, Sunosi, and Wakix, are called wakefulness-promoting agents. And these are used for conditions that cause excessive grogginess. These medications affect multiple neurotransmitters and neurological processes in the brain. Similar to amphetamines and methylphenidate, they also increase dopamine in the brain. But unlike other stimulants, wakefulness-promoting agents do not have the same potential for abuse. Here you can see that stimulants can cause several side effects. Like any type of medication, the pros and cons of treatment must be weighed. The list of side effects associated with methylphenidate and amphetamine stimulants are probably just what you might expect. Irritability, weight loss, heart palpitations, rapid heart rate, even psychosis. And the presence of these effects may mean the medication or the dose needs to be adjusted. It's important to monitor clients for these side effects and assist them with informing their provider if they occur, because there's a pretty good chance that the provider is going to want to change the medication or change the dose, because those side effects are definitely not the goal in treatment with a stimulant. And then, of course, on the left, all stimulants can cause headache, nausea, reduced appetite, anxiety, insomnia, dizziness. Although I know that if you look up pretty much any drug, you almost always see these listed. So it's pretty common. I think the reduced appetite, anxiety, that's more that stimulant sort of effect that maybe is a little too much. So I went through those kind of quick, and I apologize, but it's only 2:36 and I'm actually through all of our slides for today, but at least we have plenty of time to answer questions. I'm going to look in the chat and see, let's see, there are some questions. I'm going to go. Let's see, just a couple, but if you have a question and you want to put it in the chat, that would be great. We can talk about it now. You're also welcome to unmute. All right, I need to make my chat bigger. Okay. So, Greg, are the paradoxical effects of benzodiazepines the main effect to some people, or a withdrawal symptom of the medication? No, so a paradoxical effect is definitely directly related to the way that person responds to that type of medication. People can have paradoxical effects to Benadryl also. And really, probably any kind of medication, but I think it's commonly seen in some people with benzos and most commonly seen in the elderly population and probably children, young children. And what's lifestyle changes reduce anxiety? Well, that is an excellent question. So, really, the person has to evaluate what it is, that's the root cause of their anxiety. And sometimes, like in the case of PTSD, it's something that happened previously, but recognizing or identifying how your anxiety is triggered and trying to avoid those triggers by changing your lifestyle, reducing stress, staying away from caffeine, anything that can, that's exciting to the nervous system. For somebody who has an anxiety disorder, excessive stimulation or excitation can be a trigger for them to have more anxiety. So making those lifestyle changes, reducing your stress level, improving your diet can make a big difference. For some people, taking B vitamins is helpful. Making sure that you're getting enough sleep and that it's good sleep. For some people, it's a job change or avoiding, people who trigger you, or just being able to work on, how you respond and react. But some of that has a stronger place in therapy and working with a counselor who can really help the person work through those things mentally and figure out what kinds of changes are going to help them the most. Were there other questions about what we talked about today, or I'm happy to talk about any thoughts or questions that you had come up regarding last month's class where we talked about antipsychotics and antidepressants or mood stabilizers? So we are totally open to suggestions as well on topics for our classes. We have a list. We have classes, contents for like the next year. But if there's things that really mean a lot to you, they impact you on a regular basis, maybe you're struggling working with a client or clients who have certain conditions, please let us know so that we can make sure that we provide that training opportunity to you and to your staff. And remember too that we do record these classes, and so they are available on our Far Northern Regional Center YouTube channel. I have not shared the web address or anything, but you can just go to YouTube and type in Far Northern Regional Center and it'll come up. But hopefully, if your staff isn't able to join us on the Wednesdays at 2, hopefully they have an opportunity to watch the classes at a later time. And then, if you have an issue that comes up or a concern with client and you think, hey, I think there's a class on that, you could go in and rewatch the class or play it for your staff just to see if it helps a little bit. So I know it's early, but even though it's 2:45, you all still get your 1 hour CEU, so we got you covered. But anyways, if there aren't any other questions or comments, I'll ask Nellie, do you have anything else you wanted to mention or talk about before we end the call?
No, just that. Thank you everyone for joining us, and just a reminder that and you may have already shared this, our next call is scheduled for October 12th at the same time. So keep an eye on that with a reminder. And again, just thank you everyone for joining us today.
Thank you. Yeah, thanks, Nellie. Next month it'll be Dr. Boyle. He'll do the other half of the psychiatric diagnoses trainings, and we hope to see you all there. And I hope you have a wonderful day.
Thank you, Jen. Thank you, Nellie.
Thank you.
Thank you, guys.